Hello everyone, I am Ratzel Dichan, BSN4 student of Colegio de Santo Lourdes of Leyte Foundation Incorporated. I am here to give you a brief history of critical nursing, overview, concept of critical unit, staffing of ICU, definition of critical nursing, what critical nurses do, rules of critical care nurses, and the 7 C's of critical care. To begin with history, critical care evolved from a historical recognition that the needs of patients with acute life-threatening illness or injury could be better treated if they were grouped into specific areas of the hospital. Nurses have long recognized that very sick patients receive more attention if they are located near the nursing station. Following the Crimean War of 1854 to 1856, Florence Nightingale described the advantages of specialized areas for the recovery of post-operative patients. In the intensive care, it begins in the United States in 1920s when Dr. W.E. Dandy established the first 3-bed neurosurgical ICU at Johns Hopkins Hospital in Baltimore. In 1927, the first premature infant care center was established in Chicago. During World War II, shock wards were created to resuscitate wounded soldiers. As a result of the nursing shortage that followed World War II, post-operative patients were grouped in recovery rooms to ensure attentive care. The benefits recognized led to establishment of recovery rooms in nearly every U.S. hospital by 1960. In 1947 and 1948, the polio epidemic raged through Europe and the United States, resulting in a breakthrough in the treatment of patients dying from respiratory paralysis. In Denmark, manual ventilation was accomplished through a tube placed in the trachea of polio patients. Patients with respiratory paralysis and/or suffering from acute circulatory failure required intensive care. So, with the efficacy of centralized care of the critically ill proven, respiratory ICUs were developed in many hospitals. So, how about history of critical nursing in the Philippines? Well, early beliefs of health and illness in the Philippines were in conjunction with beliefs of mysticism and superstitions. So, the cause of disease was believed to be either another person who was an enemy or with an evil spirits. Back then, there were no medical professionals but men doing practices of magic and supernatural, or they were known to be herbolarios or herbichos. During Spain colonial rule of 1521 to 1819, Spanish regime had given limited members of women to receive primary education. So from this time, many specialized hospitals were established to care for Spanish king soldiers and civilians. At the time of the Philippine Revolution, many women transformed their homes into quarters to care for the wounded soldiers and revolutionaries. One of these was Melchora Aquino, who was 80 years old at that time and known to be the mother of the Philippine Revolution. She provided care for those who are sick and wounded soldiers. However, when a few days after the revolution began, she was arrested by the Spaniards for providing care for the rebels. And because of she wasn't able to reveal any information about them, or she didn't reveal any information about the rebels, she was deported to Guam in the Marianas Island. And after 6 years of exile, she was able to return to the Philippines in the year 1903, when the Philippines had finally gained independence from Americans. Aquino's work caring for the ill and wounded during the Revolution has brought comparison to the British Florence Nightingale. Both of these women cared for soldiers during war and paved their way for nursing practice. During American colonial rule, though the Philippines have gained independence from Spain, the United States began to instill their power upon the islands, and a conflict broke out between the Filipinos and the Americans. So this was the start of Philippine-American War. But the presence of Americans played a vital role in influencing and development of nursing into a profession. So nurses and missionaries from the United States came to act as mentors for Filipino women. An example of this was the development of the Iloilo Mission Hospital in the year 1901 through the efforts of Dr. and Mrs. Andrew Hall. A temporary bamboo clinic was erected at Calle Amparo, now known to be Ledesma Street in Iloilo City, to serve as venue for the treatment of healthcare to the very poor. So this was made possible because Andrew Hall was a doctor and his wife was a nurse. So like other professions, nursing in the Philippines evolved only from the apprenticeship system. From this time, in the year 1906, a school was built named Central Philippine University College of Nursing for now. From before, it was the Union Mission Hospital Training School. So between the time of this school was built and the time that the Philippines gained their independence from U.S. colonial rule in 1946, so the nursing profession continued to grow with the development of more nursing schools and more Filipina seeking for nursing schools. So they seek to become a nurse. So while taking advantage of these learning opportunities, Filipina also began to learn more about the United States and the hold for them. So such an extending of their education and increased pay, this began the migration of nurses to the U.S. So individuals began traveling to and fro from U.S. So the stories they brought home began to spark the interest of others to follow. After World War II, when Manuel Rojas assumed the presidency of the Republic of the Philippines on July 4, 1946, it was officially marked the end of the colonialism between the U.S. and the Philippines. So like much other countries or the rest of the countries, Philippines having ruins because of the war. So the president Manuel Rojas had explained and made it clear to his constituent that the new government was still going to rely heavily on U.S. for financial support in order to rehabilitate its national economy. So during the 1950s, the development of mechanical ventilation led to the organization of respiratory intensive care units or ICUs in many European and American hospitals. So the care and monitoring of mechanically ventilated patients proved to be more efficient when patients were grouped in a single location. During the 1960s, critical care developed as a specialty in response to improve patient outcome with ICU care and advancement in post-operative resuscitation and monitoring, surgeons' willingness to perform more ambitious surgical procedures. By 1970, most U.S. hospitals had at least one ICU. In the year 1970, 29 physicians with a major interest in the care of the critically ill and injured met in Los Angeles, California to discuss formation of an organization committed to meeting the needs of critical care patients. In 1986, the American Board of Medical Specialties approved a certification of special competencies in critical care for the four primary boards: anesthesiology, internal medicine, pediatrics, and surgery. Between 1990 and the present, critical care significantly reduced in hospital time as well as cost incurred by patients with diseases such as cerebrovascular insufficiency and lung tumors. The development of new and complicated surgical procedures such as transplantation of the liver, lungs, small intestine, and pancreas created a new and important role for critical care following transplantation. In 1997, more than 5,000 ICUs were operational in intensive care units across the United States. Seed of critical care was sown about 140 years ago by Florence Nightingale. So the first intensive care units emerged in the 1950s to provide care to very ill patients who needed one-to-one care from the nurse. So from the environment, the specialty of critical care nursing emerged. So let's proceed to the definition of critical care. Critical care is the care of seriously ill patients with life-threatening illnesses or trauma, and is also patients who have the potential to develop life-threatening complications from the disease. So this is how ICU look like. What conditions require intensive critical care? Acute life-threatening illnesses which are potentially reversible. Another is acute illnesses with potential unlikely to occur life-threatening complications. Monitoring of vital parameters in patients with symptoms or signs that suggest the possibility of an evolving life-threatening illness. Another is acute or immediate life-threatening crisis or complications in a chronic illness, even when the latter by itself is almost certain to cause of death within a matter of months, like for example a patient with cancer at the stage when life expectancy is 3 to 6 months. An acute complicating pneumonia in such patient with a life-threatening emergency which is treatable, curable, and may not well necessitate critical care. So therefore, a critical care unit is already mentioned, should not be used for terminal cases where the end is close at hand. So the tendencies to use a critical care unit as the last halt or stopping station before an expected departure from this world should be strongly restricted. To picture out the patient in an ICU, provided with complete medical facilities. We proceed to staffing of ICU. This consists of director, medical plus nursing, physician and consultants, resident doctors, sisters or IC, nursing sisters, the ratio is 1:1, physiotherapist, technician, and ancillary staff. We proceed to concepts of ICU. More care continuous and intensive for number 1, specialty of care for number 2, another source of areas like medical, surgical, and etc. Next is open and closed, provides advanced life support through the application of technology, initial assessment of airway, breathing, and circulation, and intervention. Definition of critical care nursing from Oxford Dictionary gives the meaning of critical as crucial, as crisis, of emergency, as requiring immediate action, and of intensive, as thorough and constant observation. So these are all interrelated because those patients who present with life-threatening conditions are in a crucial state or situation needing immediate action and requiring thorough and constant observation. So critical care nursing is that specialty within the nursing that deals specifically with human responses to life-threatening problems. A critical care nurse is a licensed professional nurse who is responsible for ensuring that acutely and critically ill patients and their families receive optimal care. Critically ill patients are defined as those patients who are at high risk or actual and potential life-threatening health problems. What critical nurses do, or what critical care nurses work. According to the registered nurse population study of 59% of all nurses work in the hospital setting, and critical care nurses work wherever critically ill patients are found in intensive care units. Pediatrics, ICUs, neonatal ICUs, cardiac care units, cardiac catheter labs, telemetry units, progressive care units, and emergency departments and recovery rooms. Let's proceed to the roles of critical care nurses. Critical care nurses work in a wide variety of settings, having many roles. So they are the bedside clinicians, nurse educators, nurse researchers, nurse managers, clinical nurse specialists, and nurse practitioners. The onset of managed care and the resulting migration of patients to alternative settings, critical care nurses are caring for patients who are more ill than even before. So managed care has also fueled a growing demand for advanced practice nurses in acute care setting. We have advanced practice nurses. These are those who have received advanced education at the master's or doctoral level. So in the critical care setting, they are most frequently clinical nurse specialist or CNS, or acute care nurse practitioners or ACNP. So a CNS is an expert clinician in a particular specialty or critical care in this case. So they are responsible for the identification, intervention, and management of clinical problems to improve care for patients and families. So they provide direct patient care, including assessing, diagnosing, planning, and prescribing pharmacological and non-pharmacological treatment of health problems. So ACNPs in the critical care setting focus on the making clinical decisions related to complex patient care problems. So their activities include risk appraisal. We have interpretation of the diagnostic test and providing treatment, which may include prescribing medications. So although certification is not a mandatory for practice in a specialty like crucial care and everywhere, many nurses choose to become certified. So certified critical care nurses or CCRN must have been in critical care practice for a minimum of 2 years to be eligible for the examination. So lastly is the 7 C's of critical care. So we have compassion, communication with patient and family. Third is consideration to patients, relatives, and colleagues, and avoidance of conflict. So fourth one is comfort. This is the prevention of suffering. So fifth is carefulness or avoidance of injury. Sixth, consistency, and the last one is closure, ethics, and the role of care. So that's all. That's the end of